ladies and gentlemen. Welcome to another episode of Sehat Beyond the Clinic. And today we'll be talking about more about our environment. As we've noticed lately, the weather has been quite hot these days. And what better more to learn from an environmental health expert? Today's guest brings decades of experience at the intersection of environment, health, and safety. Dr. Subramaniam Karuppannan is an environmental health and safety specialist with more than 39 years of professional experience, spanning key institutions in Malaysia, including the Ministry of Health, local authorities, and the Department of Environment. He is currently serving as a part-time academic at the Faculty of Science and Technology, Open University Malaysia, as well as the International University College of Management and Technology in Talingjaya, where he is actively involved in teaching, research, and postgraduate supervision. Dr. Subra has also held senior academic leadership roles as head of department and professor in environmental health and safety at UITM Puncak Alam and also Mahsa University. He has contributed extensively to academia as an external PhD examiner for institutions such as Curtin University Australia, UPM, UITM, MSU, Sabarjaya University College of Medical Sciences, and Segi University. Beyond academia, he's also played important roles in national policy and advisory platforms, such as being the member of the MQA Setting Standard Committee under the Ministry of Education, and as a former member of the Environmental Quality Council under the Department of Environment. He's also actively involved in professional bodies, including serving as president of Malaysian Solid Waste and Environmental Management Society, and contributing to organizations such as the Malaysian Association of Environmental Health and the Malaysian Industrial Hygiene Association. Internationally, he's also represented Malaysia at platforms such as the World Congress for Risk and has participated in global programs including Japan's JICA initiatives. Welcome, Dr. Subra, with your extensive expertise in environmental risk. Let's discuss on the current issues of a heat wave. But first of all, Dr. Subra, how did you get into this line of being an environmental health and safety expert?
Okay, good morning, Dr. Ahmed. Thanks for interviewing me and also for that long introduction.
Yeah.
Okay, so you want to know how I get involved in this?
Yes, sir.
Depending on, probably it starts from my student life, right, when I'm very young. So we were taught to love the environment. So from there we adapt ourselves to surroundings. For example, if it's very hot, we go and jump into the swimming pool. Those days pools are very nice and clean. Nowadays the pools are not so clean, especially the streams. So from there we have developed my working line, and from the working line I went into academic line, then from academic line research, and some of these research include air quality, temperature variations. So today when we face the heat waves, it is a matter of looking at real life experience compared to what's happening now, right? So the urban setting is totally changed from what we were facing before. Maybe 40 to 50 years ago, there was a lot of trees, a lot of shaded areas, so we didn't have that much of heat wave. But now, without trees, with urban settings, there we are facing this problem. So maybe from there, that's how I get involved in this line of work. Yeah.
But it's not like very, run of the mill kind of, choice for students these days to say, I want to get into the environmental health line. So what would your experience be? Like, how did you get into this line? Usually people want to be, let's say, doctors, engineers, So what was your experience like? Why did you get into this line?
Maybe it's purely out of need. So in those days when we wanted to do further studies, there's not many opportunities. So I saw one advertisement for this diploma from the Royal Society of Health, the promotion of health. So this is actually a training program from UK, but being conducted by Ministry of Health with scholarship. So I thought that's a way forward for me. So I applied for that course, and I got it. So when I got it, I took it. So for me, it took me 3 years to get this diploma from the Royal Society of Health, and that gave me an eye opener for the future. So probably it helped shape me into this in this line of work. So in those days we work as a health inspector. So we used to do inspections, and then investigate and control and try to prevent diseases from happening. So I particularly like the part where we prevent diseases from happening, and I've done it before. So I think that is the reason why I get involved more deeply into environmental health. So I proceeded from diploma. Then after about 16 years of working, I went to UPM to take up the degree program in environmental health and safety. So that gave me a second dimension of research and development. I continued with my master's, and then after that my PhD, and I continued with my academic work. So I actually worked in UITM first. Then in UITM, I was teaching both diploma and degree, then up to master's and postgraduate. Then when I retired, I joined Masa University. Then after that, I came out and I'm teaching part-time at the Open University and private colleges. So this is how I get involved and still working in this line. Currently, I supervise research students. So probably the reason why I keep active is because of these research students. I don't teach a lecture generally, but I go for researchers more focus. So it gives me a scope for the future development. That's how it works lah. But other than that, that's how we manage lah.
Okay. So you said you started out as a health inspector, and then we call it IK, or Inspector Kesihatan.
Those days it's inspector that.
Yeah.
Then the nomenclature change came.
All right.
They became environmental health officers lah.
So they worked closely with public health officials. You know. So when you started out, were you already able to see the gaps in our environment that needed preventing? You know?
Actually, one of the reasons what you said just now is not the gap; it is the development. The country is developing very rapidly, so you need new technologies to come in. So when you have new technologies, so if let's say we are depending on old technologies, then we cannot cope with what's happening now. That's what we are seeing now. If I want to cope with the current situation, I need to make sure that I have technology that will support me. So there, for example, there I'm using air conditioning, fan, ultrafine particle filters, so that we keep ourselves safer. But these technologies now, what happened 20, 30, 40 years ago, we don't need it. But now, because the situation is such, we need it. So the current technology needs current professionals. So these current professionals are being upgraded now. So we have both two types. There are those who are related in environmental health and those are related in safety and health. So those in safety and health, they're falling back on training from NEHAP. But those training from public health institutes are still much earlier. So if I learn about safety and health, it's from the public health institute. So the two dimensions will meet at one point. So when you talk about outdoor, the outdoor environment is a different issue. When you talk about indoor, it becomes even more critical. So workers and people who stay at home are more critical condition indoor rather than outdoor. So the indoor must be taken care first. So our job is in that area. So when we don't take care of the indoor that well, then the outdoor will become another problem to cope with.
Coming back to the topic of heat wave, would you say that the heat wave currently now that we're facing now, is it linked to like the way things were in the past? You know, you said just now, I mentioned gaps in the past. Did those things in the past contribute to the heat wave we're experiencing now, and what was different?
Okay, we look at it two ways. One is the development, and the other one is the meteorological changes.
Right.
So development, we have been cutting down trees and forests to develop urban areas. So the urban areas create these heat island issues. But the meteorological department also is monitoring the temperature, and they clearly show the temperature rise of 1 to 2 degrees Celsius over the last four decades. So now they are predicting by 2050 there will be another 1 to 2 degrees Celsius increase. So when the temperature rises, of course you are going to face not only heat island issues or heat wave issues, we are going to face other issues like droughts, we are going to face food security issues, we're going to have water scarcity, and other health issues will come up, which are in line with that. So earlier when I mentioned about technology, this is the problem that comes out. So is the technology that we have able to cope with what we are going to face in the future? So we have to change. We have to be more open and more change. So if you are talking about internal medicine, for example, we have a heat stroke, you can treat it internally, but how do you treat the environment? So you need to prevent. So to prevent that, we need to plant more trees. So who's going to plant the trees? So we need to have policy changes. So policy changes will come from research and development as we go on. So these are the things that is of concern now. So the heat wave is not something that is created overnight. It takes a long time to build up. So over a period of time, it builds up. One classic example, if you go to, we take Putrajaya for example. Putrajaya, when initially was a forest, and then they cut it down, then they make it into plantation. Then from plantation, then they cut it down again, and then they make it into a huge city. And now they're facing heat island issues. If you don't believe me, you go and measure the temperature there. I'm very sure the temperature is very high. So the reason, because of the buildings do not absorb heat. They are actually reflecting heat. So when they reflect heat, so the urban island heat become a problem. So that is how the heat wave get worse.
So from you mentioned just now that from the impacts to internal medicine that they can do from resulting from heat waves. What does it do to due to the extreme heat? What can happen to a lot of to our population?
If our body temperature is at say 36, the average about 36 to 37 degrees Celsius, when the heat wave comes, the radiant heat will enter your body. We are also absorbing heat. So when you absorb heat, your brain and your heart temperatures will change. That will cause the heat stroke to happen. But to exposure to the heat. And of course, this doesn't happen overnight. It takes time. So when it happens over time, we by drinking water and cooling down, using air conditioning or whatever to support these body systems. So we manage to control the temperature. But we never control the body temperature, then it becomes critical. Then we end up in hospital, and that's where the internal medicine takes over. So, but that is a different issue. But outside, how do we handle this matter? So we need emergency response. So if at home, maybe a different approach. Maybe we do what called rapid shower, or maybe cooling with wet towel or whatever that we have to support the body lah. But if we are in the what do you call working condition is totally different. That is why DOSH has also come out with standards. So they want to limit the temperature at about 30 degrees Celsius, so that the workers are not exposed to too high heat. So when you have heat wave, the temperature variation inside the building will also cause this problem. So they will face more problem lah. So both we have to be tackled. So whether you are in the hospital or outside the hospital, before the patient enters the hospital, something needs to be handled. If not, the hospital is not going to cope. If you have 1,000 patients within a day, what happened in Pasir Gudang will happen all over Malaysia. So we need to think in that way lah. So we need to reduce the number of patients going to the hospital rather than getting too many patients lah. So that is the issue of preventive work with curative work.
In your experience, 30 years already, did you experience heat wave in the past, 30 years ago? How was the temperature back then? How did people cope, especially children, because now children are exposed to heat due to school? How did they cool off? How was it different back then? Or was it really cooler back in those days that we didn't have any heat wave at all?
I think not that the heat wave was not there. It is how we plan the activities. So if I want to do, let's say we do a cross-country run, for example, in school days lah, cross-country run, or you want to do exercise, or you want to play games. Normally we'll keep it in the early morning or late evening. So towards the afternoons we don't allow.
So it was already hot.
Because already hot. But that kind of thinking was already with our physical education teachers. They already knew. So they make sure that we don't get exposed to hot sun during the midday. So it's early morning or late evening. And then the dress that we wear is all light dress. It's suitable for sportswear. I remember schooling time when we wear shorts. We don't wear long pants. Now we are wearing long pants. We are supposed to be keeping ourselves cooler, is it? So we never realized it until now only I realized, my God, that time we were wearing short pants because we were trying to keep ourselves cool. So that could have been a reason why the dress also plays a role. So if we talk about, in that sense, I have to talk about thermal comfort. So if we talk about thermal comfort, there are four major factors there: temperature, humidity, clothing, and also air conditioning. If we don't put in these factors inside, so the body will definitely heat up.
Yeah.
So those days, if you talk about school, last time we don't have aircon. We only use fan, open ventilation, and then we depend on wind, so that keeps us cool. But now with the cooling system not working that well, so we face problem.
Now we have a lot of machinery to help the heat wave, like aircon, filters, but heat wave still happens. Is it our housing designs or building designs contributing to not only heat wave but poorer preventive measures?
Now we talk about that is called built environment. So built environment, if you live inside a cave, you go inside a cave, it's very cooling, The reason being because the environment can absorb the heat. But our system is not cave. We are housing area. So housing area, the buildings are depending on concrete, bricks and so on and so forth. So they should be designed to absorb the heat. They cannot absorb the heat, so they are radiating in the heat. So when they radiate heat, definitely the heat wave will come into the house now. But if you stay in a single-story house and a double-story house, you can see the difference. Double-story houses, the lower floor is always less heat. The top of floor, higher heat. So that is part of the absorption factor. So we can't help it, but that's the design. So maybe the building engineers, they need to look at whether they can come out with some systems where they can cool the housing area using some other technology. So that could have been developed. So this is something that we depend on others to do for us.
So urbanization is also a factor causing heat waves and all.
Yes, yes. Urbanization definitely is a factor.
How about climate? Because we're seeing a lot of changes in seasons, hot seasons, rainy seasons. Does that seasonal changes? Because I'm not sure what time of the year is already rainy season.
Yeah.
Then sometimes there's hot season in the middle of rainy season.
No, our weather is definitely equatorial temperature weather, so we don't have to worry that much. Throughout the year, we have sunshine, we have rainfall. There's no issue. The problem comes when we talk about Earth's rotation. So when it swings toward the sun and swings away from the sun, so that is where we face this problem, But that cannot be helped. That is natural. So if you know already we are having a heat season, then we take the precautions. So whether the precautions are physical or whatever, lifestyle changes, we have to do it. So if we need to drink more water, drink more water. If we need to have aircon, we need to have aircon. But if those who don't have, then you have to come up with some other system. Because this is an urban system already, we have no choice. If you take the whole of the Klang Valley, the whole area is a metropolitan area, the whole area is city area. So you have to adapt to that change. If not, you have to look for a place without metropolitan area. Then the lifestyle will again be affected. So our lifestyle, we have to work in the urban area, stay in the urban area. So this is where the heat wave becomes worse.
We can be more prepared by getting information from meteorological department.
Yes. Meteorology department has already alerted us somewhere in December. They already alert us, and they also give the classes of danger, class 1, 2, and 3. So normally we go for class 1. Class 1 is the safest. So it's about 30 degrees Celsius. So what are the precautions to be taken? So we take those precautions. But if it goes up to 2 and 3, then it becomes very critical already. But in Malaysia, I don't think we reached that stage yet. Maybe in certain districts or certain states like Perlis, or maybe in Sabah, there they may face this problem. Very hot, yes. My friend told me they have a bloom of harumanis because of the heat wave. Yeah. So they have so many fruits coming out. They are appealing for people to buy them. So that means the fruits are a lot. There's a harvest lah. Good harvest. Yeah, good result of the heat wave. Yeah.
Keeping cool with cold mango.
Yeah. So now the other issue we can get is more fruits out of this. but it's short-term gain lah, not a long-term gain.
But if the trees are dried up, how are they going to?
That is a different issue.
Yeah.
That is probably related to drought. So
Drought.
earlier I mentioned, remember, when heat wave, you will be coming out with drought. So drought means our water system, our irrigation system all will be affected. It could be in the early phase because towards June it will get worse.
The hotter.
Yeah,
hotter
it's
month.
going to get hotter from now until June. So it will be we have to be prepared for it lah. But here we get rainfall. If you notice, we get intermittent rainfall, so we don't feel it so much. But in states like Perlis and Sabah, they may be very dry. So the humidity will be very low, so it becomes worse.
Okay, still talk about heat wave, but coping strategies. As a child, 30 years ago, how did you cope with heat wave? I'm seeing pictures like kids jumping in the river, keeping cool. Now in an urban place like Klang Valley, I don't know where there's a river to jump into. And it's so hot.
Probably the children, we talk about children lah. Children, they need to know when their body temperature goes up, they'll go and they should take a shower, cool shower lah.
Because kids spend the whole day in school without showering sometimes.
School should be providing shower. I don't think the schools are providing shower. They have a bathroom but no shower.
Yes.
So at least you have a shower. The kids can go in and take a quick shower and cool down. That's important. If not, you give them what do you call this sprinklers, where they can wash their face, their hands, and legs.
Mist.
So they're like misting system lah. Probably, I wouldn't advise misting, but that'll be a bit costly lah. But at least you have shower lah. So that for emergency they can go and shower and come on lah. I think that's good because I think I remember my time when I'm schooling we have showers. Even in the school we have showers. But now I don't know. So parents need to look into the children's welfare rather than looking at their own work lah. So this may be something that need to be concerned about lah.
Okay, Dr. Subra, coming back to our discussion, okay, for the average Malaysians, what are simple practical ways to stay safe during this heat wave?
I feel for Malaysians, we need to stay in shaded area, drink more water, and then wear light dressing, light clothing lah, so that they can don't absorb heat, radiant heat. I think we need to plan the activities. So if we want to leave the house, we leave early in the morning, and then when we come back home, come back late in the evening, so that we avoid the hottest part of the day lah. So this may be one way of avoiding the heat wave issues.
Do you see this heat wave issue becoming, recurring in the coming years?
We have been facing heat wave issues for the last, I think, 1 or 2 decades already. It has been there. It is not something new. It has been coming on and off. But when we have this El Nino effect, recently the El Nino effect, it was mentioned it comes in cycles. So when it comes in cycles, so we have to adapt to that cycle. It is natural cycle lah. So if the environment heats up, so we need to adapt to that. Then our environment cools down, we need to adapt to that also. But we are lucky we are staying in the temperate area. So equatorial area is able to absorb the heat. But if we are in the Arctic or Antarctic area, then become worse. So any water release from there will cause flooding here. So we are in that sense we are lucky we are here. So if we are in the northern area or southern area, we're more exposed to floods and so on and so forth. So hopefully we are not affected in that way lah. So the heat wave here is in the short run only, but the climate change will be in the long run. So that will be something that we need to be worried about also.
Based on your work with the Ministry of Health, academia, universities, research, what has been our public health system's efforts to face such issues, and do you think we're prepared to face this again?
Yeah. Okay. Earlier I mentioned about this climate change issue. So we have projections from the meteorology department that the temperature will rise about 1.5 to about 2 degrees Celsius coming towards 2050. So for that we prepared a policy brief. How are we going to face it? How are we going to? So we are expecting a lot of floods, besides heat wave, floods, droughts, and also that this will impact not only health but also impact on agriculture and water resources. So what will happen is agriculture will probably have negative impact. Not always a positive impact, also negative impact. For example, rice may decline.
Because of the drought.
Yeah, because of the drought. And then the water resources may cause also drought and floods. And then human health, we are definitely going to face problem with heat-related diseases, all right, and especially among the elderly people and also the children, vulnerable. And then the environment, as a whole, the environment also going to suffer because the sea will also suffer, river also will suffer. So they're going to hotter, yeah. So that will cause other problems to happen in the sea life. But for degradation of the environment, we have to think about reforestation, green spaces, green lungs, which the planners have already put into place. But sometimes the green lungs are being invaded, all right? So people go in and build houses, I don't know what all. So that become problem for the residents. So if I have a green lung in my area, so I want the green lung to remain as a green lung. I don't want any other development there. So when you develop that area also, then where is the green lung? So then if you notice all the houses, they do not plant trees, all right? They may have trees, but now all the trees are gone. Why? Because they're taking up for car park and so on and so forth. So this will in the long run cause problem for the residents. So they never realize that, but in the long run this will become a problem. So you have to think about shading, how do you increase the, what do you call, tree cover, not necessarily grass, but tree cover is very important. This will help in the long run. But our national plan will be towards adaptation, resilience and adaptation. So how we want to adapt to this climate change will happen in the next 20 to 30 years. Now in 2026. So we have another 24 years before we reach 2050. Yeah. So hopefully before that we are already putting all into action. But I noticed the government has already taken the measures. The government has taken the measures, but it is the public who needs to be more aware. So awareness need to be, yeah. I think it depends on the public also. Because if they don't participate, it's very difficult. Simple things like 3R, recycle, reuse, and that kind of thing, we take it for granted. But that has an impact on this also. So this will benefit us in the long run.
What about stakeholders such as developers, contractors? Are they contributing towards better build quality, better design? Is that addressed in the policy brief?
So when we talk about development, we talk about town planning.
Yeah.
All right. So the town planners will lay out the town plan, but the developers look at the town plan and then they adapt from that for building. So when they want to build, so these builders must look into the technology as I mentioned earlier. So what is the suitable technology for urban areas? So if they take the suitable technology, then we will benefit from that in the long run. So those technologies that we have already used before may be suitable or may not be suitable. So that depends on what's happening currently. So, but we are staying in homes that were designed maybe 20, 30 years ago. We come up with low-cost housing. Low-cost housing may or may not be suitable for heat wave. But so if you stay in that house, then you understand. So those people staying in the house, they have to adapt to that condition. Or if not, they just have to demolish and build something else there. So in the long run, this will become something that the developers, maybe the local authorities, rather than the government as a whole, it should be the local authorities look into it. So then it will help. It will help in the long run.
Before we end, what's one message to Malaysians to remember during this heat wave?
Heat wave.
What are the steps?
I won't go in so lengthy. All I can advise is stay in shaded area, drink lots of water, wear light clothing, and if possible, stay in a place where the temperature is cool. Cooler rather when compared to outside area. So any activity, plan the activity to be early morning or late evening, and then avoid getting dehydrated. You dehydrate and with the high temperature, that's a recipe for disaster. So careful with that. And then another one that I like to mention is something about open burning. Right, during dry weather, open burning becomes a practice among farmers and also among so people like to burn. So they don't realize that when you burn, those particulates that come out will also aggravate the situation. They will cause the heat to arise because these particles will get trapped in the atmosphere. So the heat, when the heat comes from the sun, it gets trapped in the particles. So the temperature will definitely increase. So that's another reason why we face a heat wave also. So probably in the long run, we also think about that also lah.
One last personal message.
Yes.
To those interested to get into the line to become an environmental expert or in your line, IK or Inspector Kesihatan.
Oh.
What your message be to those?
Oh.
Because it's a very, we say, niche area.
Actually, it depends on your passion.
Right.
It comes from how you grew up lah. So when you grow up, if you love trees, you love shaded areas, you love the environment, you go to this stream, you go have a swim, those the kind of thing will build you up. But if in the modern environment, we go to swimming pool rather than this kind of area, we miss that part lah. So that is the one that molds you. So when eventually later in life, you asked me just now about how to get passion. So the passion will come from how you have lived before. So if from young I have been molded, probably I lost my father early. So that had an impact on my life. So I have to adapt myself to the changes. So we were like independent. When very young, literally we grew up on our own. So parents were working, my grandmother all working. So they are not able to take care of us. So we have to look after ourselves. So that makes us independent. So when you are independent, then you start developing learning skills. So the learning skills you have to develop yourself. You cannot depend on handphone or iPad or whatever. You spend time on the outside work. Yes. So one of the things that you should do is concentrate more on research lah, practical research, that can benefit people in the long run. So I may not talk about research a lot, but I have done research work.
Because you're passionate about it.
I'm bringing accidents into the picture. Accident incidents, you have to look at the triangle. The triangle of accidents actually caused by environment, unsafe act and unsafe practice. So the unsafe practice and unsafe act comes from the human, but the environment comes from outside. So you cannot control that unsafe environment. So to control that, you have to manipulate the environment. So that is why in our system, we need to have technology inside the picture. We cannot run away from technology, engineering work, and so on and so forth. So those people who want to come into this field need to triangulate the area. So I need to have knowledge in engineering works or environment works, or maybe on human behavior, and then maybe on technology also, so that you develop the area. So in future, the research area will go in that line. If you're talking about urban health, then we have to talk about built environment. So if you talk about waste management, you have to talk about sewage management. Those are things that are related to this in the long run. So whenever there's a heat wave, so all this will be affected. So it's a ripple effect. So if you want to have environmental health specialists, environmental officers, they need to increase the knowledge area, practice area, and also the attitude must be going towards that area. The passion must be there. So, but I still think more research needs to be done, so that will be translated into policy. So finally, end of the day, it will come to enforcement lah. But enforcement only comes after a long process. So this research is very critical for that area. Yeah. Thank you.
Thank you very much, Dr. Subram. You can hear how passionate he is about the environment.
Yeah, thank you.
To those listeners out there, have passion in what you do. And we've learned a lot from the experience that we shared today.
Thank you.
Everybody. Thank you so much, Dr. Subram. See you in the next episode.